name is Laura Burbano. I am one of the admissions advisors here at University of Western States. I'm very happy to be with you all. So today we have two very important faculty members from the Clinical Mental Health Counseling Department. We have Dr. Mitchell Cox, she is the program director, and we also have Dr. Patrick Davis. So he is faculty from the Clinical Mental Health Counseling program. So this is what you should be expecting from today's webinar. So we will have a conversation with the program director of our program, but also from with our faculty member, Dr. Davis. You are in listen only mode. Thank you again so much for submitting your questions in advance. We will try to address as many questions as we can from you all. Then if after the open house you still have some questions, just please feel free to schedule a one-on-one advising appointment with me, or you can just email the admissions office and they will just redirect you to the appropriate person. In that case, it will be me or somebody from the Clinical Mental Health Counseling program. So we're gonna start with the schedule for today's open house. So we are going to have short introduction and welcome from the program director, Dr. Mitchell Cox. So Dr. Cox, thank you so much for joining us.
Hi, everybody. Welcome from Oregon. I'm in the middle of the snowy Central Oregon right now. It should be sunny, but it's not, and it makes me sad. But I am happy to be joining all of you today, along with Laura, the queen of all admissions advisors, and Dr. Patrick Davis, one of our newest full-time faculty members. As Laura said, our focus today is trying to help you determine whether UWS and our clinical mental health counseling program is a good fit for you. So I hope we are able to get to all of your questions and address those thoroughly. If not, any follow-ups you have, I know Laura and I and Dr. Davis will work on getting answers to you via email. Thanks again for joining us, and I'll be back on in just a few minutes.
Thank you so much again. So now we have Dr. Patrick Davis. So Dr. Davis, if you want to please just click on your video so that the audience can see you, and you can just say welcome and introduce yourself and your role in the Clinical Mental Health Counseling Department. Thank you so much.
Very good. It's saying that the host has stopped the video, so I might not be able to show my little face. We'll try again. All right, very good. Yes, I am Dr. Davis, and as Dr. Cox was saying, I am recently joining the faculty at the University of Western States. I'm excited about the opportunity to meet and talk with all of you today. I think it's a great time to join the profession and join the program. And so I think that you will find as you talk with Laura and Dr. Cox that the UWS program is quite unique and highly admired by the folks who have the opportunity to come to school over here. So I'm actually talking to you all from Southwest Florida, and so it is nice and sunny over here. So I look forward to this conversation. Thank you.
Thank you so much, Dr. Davis. So now we are gonna just stay here so that we can start with the conversation. So Dr. Cox and Dr. Davis, please just join me in the screen, and we'll start with the first question from our audience.
All right, let's do this. Dr. Davis, the colors are fabulous, and it looks a lot like Florida.
Thank you.
Okay, perfect. So let us transition to the first question. So somebody from our audience is actually interested in knowing if you can share, any of you, a little bit about your intention. What was your initial intention at being a counselor? Like what was that actually sparked your interest into getting in this helping profession?
Dr. Davis, why don't you start? You have a great story.
Well, I don't know if the story is great. I think the story that you're referring to is when I was working in a warehouse, and an individual recommended I go to college. More specifically, what got me interested in the counseling profession was working at a summer camp with a bunch of adolescents, 12 to 18, and going on canoe trips and getting the opportunity to meet those children more intimately and in a more authentic way. And although they were quote unquote church kids, they had a lot of difficulties, a lot of struggles in their life, and I was trying to find ways in which I could better help them understand their problems, share with them some of my experiences that might be useful or beneficial to their happiness and success. So I think that's where my initial spark to become a helping professional really kind of ignited itself. And years later, I went to grad school and started this journey officially. But I think officially, I'm sorry, but initially, I would say that working with those adolescents at the church camp got me interested in becoming a helping professional.
Okay, thank you so much, Dr. Davis. Dr. Davis, if you don't mind, I made you a host, and I was wondering if you can please start my video.
Sure, let's see if I can do that. All right. I don't know if it's allowing me to. I'll let you make you the host. How about that?
Yes, thank you so much.
You're welcome.
Okay, excellent. So while we are here, Dr. Cox, if you want to share with us a little bit then about what was your initial approach, what was your interest in the profession, and why did you choose specifically counseling?
You know, my story is not nearly as inspiring as Dr. Davis's is. My undergraduate background is in business, and I was a steel fabricator for many years. When you drive around your city and you see red or gray steel, the frame of buildings going up, I owned a company that did that work. And then the first Gulf War hit and manufacturing tanked, and I looked around and said, oh my gosh, what am I going to do for a living now? Well, people like to speak with me, and I seem to be the receptacle for people who want to chat a lot. And I went, maybe I should try counseling. And that was the start of it. But once I was in my program, my master's program in counseling, my world just completely expanded. What I learned about the importance of relationship and healthy communication and healthy functioning was so significant. And then, of course, as part of most counseling programs, you're required to engage in counseling yourself. And I guess, got really blessed with an excellent clinician and learning the ways in which a good clinician could be significantly beneficial and could change a life really impacted me. On top of that, I had very good educators. And as soon as I started practicing in my clinical courses and realizing how much, I want to say, power is the wrong word, but we'll come back to that later, how much power and influence we as clinicians have over others, my goal was just to excel at being really good at this profession, because I never wanted to harm another person, and I only want to be that person who lifts others up. So for me, my story and passion for this field was less about how I got here and a lot more about how sobering it is once you start to realize the impact you have on others.
Thank you so much, Dr. Cox. That's a very empowering story. So I think it goes along the lines to what some of our participants want to know. One of the questions that they submitted is about specifically the real world setting interplay of counseling and sport and performance psychology, given that our counseling program is very unique. It sort of like combines a little bit of both fields. So if you can please provide examples from your practice as a counselor or as a certified mental performance consultant into what are the different ways in you can where you can use the sport and performance psychology approaches and also the counseling approaches.
Yeah, it's a great question. If it's okay with you, Dr. Davis, I'll take that one. Yeah, looks like it. Okay, thank you. So first off, none of the full-time clinical mental health counseling faculty are currently CMPCs. This is an integrated degree, and what that means is that our experts in sport and performance psychology who run the sport and performance psychology program partner with us, and we provide the mental health counseling content and skills courses, and they provide the sport and performance content and skill courses. So they have CMPCs. That's important for us to note because there are there's a balance of two programs and you get two sets of experts. In the field of clinical mental health counseling and in the field of sport and performance, what we know is that the trend is that folks are utilizing both together, and the jobs that are being posted right now are looking for both clinical skill sets and sport and performance experience or sport and performance consultant certification. What's really important, and a misnomer that exists in our field, is that if we dually train you in this integrated degree, you are going to be able to dance back and forth between with one client being their sport and performance consultant or being their counselor. And we are never going to teach you to do that. In fact, we would think that is unhealthy, sometimes unethical. We want you to be very careful about that. What the dually integrated degree really does is allow you to understand and utilize the skill sets from each field, sport and performance consulting psychology and clinical mental health counseling, so that you can choose in your practice what approach you want to take with a particular client. So let's say a client comes to me and says, I'm having some performance issues, and I say, let's meet and I'll do an assessment. And we find out that they really are strictly sport and performance issues. Then I might put a consultant hat on if I were a CMPC and only work from the client from that perspective. And if that client started to demonstrate mental health symptoms, I would then have the expertise to see that and to then maybe refer out to one of my colleagues who is doing clinical mental health counseling, or vice versa. So we want to ensure that everybody who spends money on this degree actually gets to practice it for as long as they want. And that means teaching you that ethical fine line between what you're doing and when you're doing it, if that makes sense.
Thank you so much, Dr. Cox. And just to clarify, from an admissions standpoint of view, what we're offering basically is a master's. So we have our master's in clinical mental health counseling. So if you just want to go ahead and complete a coursework in counseling, that's totally fine. You can just choose the master's degree. And then we also have the doctoral degree, which is the one that Dr. Cox was mentioning, this integrated degree that offers a specialization in clinical mental health counseling, where you can finish first your counseling master's and then hopefully seek licensure in your state so that you can become an LPC, and then afterwards just transitioning into finishing your doctoral degree altogether. So that is sort of like just from an admissions standpoint of view. The next question, Dr. Cox, is specifically about professional identity development. So I'm going to read the question because I think it's very pertinent. It says, professional identity development is an important component to prevent burnout and overall job dissatisfaction after graduation. Can you talk about the ways in which the program addresses aspects of professional identity development? Which classes or opportunities are available for students in the program related specifically to professional identity development?
I'm glad you read that. There is a lot of nuanced information packed in one question, and it demonstrates, whomever wrote it, that you really do understand the helping professions. So one of the reasons, there are many, but one of the reasons we are pursuing CACREP accreditation, which is the gold standard in our field, is that CACREP has a significant emphasis on professional identity development. In other words, we're proud of our clinical profession, and we want to engage with others and really build that profession and an identity that says this is who and what a counselor is, what they do. And so the professional identity development can be achieved through things like association memberships, contributions such as presentations or speeches at conferences, the types of specialization training that you seek in your field. And then there's this informal professional identity development that is sort of nuanced in this question, and that is about building relationships with other professionals in the field. So I'm going to briefly touch on each of those. Number one is we require at admission or first class in the program that every person in our CMHC program join the American Counseling Association as a student. And that has a huge student representation and lots of services to students, including such things as free legal assistance, free liability insurance, and the variety of conferences that are available through ACA from at the state level, the regional level, and the national level. And we encourage students to participate in those conferences, even virtually. They have been virtual for the last couple of years, and we participate in those conferences. In my 18 years as a counselor educator, I have contributed to the publications or presentations at the American Counseling Association and other conferences with 79 students. And that's a number I'm really proud of, because that's a lot of help in encouraging their research interests and pursuits and their presentations. Informally, there is nothing more valuable than the relationships we form with each other. In fact, counseling field is all about relationship. And because of that, we start to orient you toward building relationship with your peers in the program, even when they come from across the country or a state you never intend to live in or visit. What you find is that people come from a variety of backgrounds, some helping professions and some not, some sport and performance professions and some not. But we do that by giving you the opportunity to engage with one another in a clinical mental health counseling hub, in something that we call Course Cafe. So in every course, there's an opportunity for you to engage with your peers outside of our purview. So we're not monitoring that dialogue. Our students are creating things like cohort Facebook pages. Our admissions office creates those as well. We engage in nonstop discussion forums in every course with really meaningful questions, so that our students get to know one another, not just their opinions or their regurgitation of content, but they actually learn one another. We have so many opportunities for you all to develop relationships. The other part of that question that I think is so important is the recognition that in the helping professions, we have a high rate of burnout. That burnout tends to result in a couple of things. One is somebody just saying, I don't want to do this anymore. And then they spent all of their income and said, never mind. And the other thing is ethical violations. When you sort of drop your guard because you're tired or frustrated and you make mistakes. And so a significant portion of what we teach in this program, but also what we model as educators, is self-care. We teach you what that means, how to engage in it, how to consider yourself and your clients a whole person, body, mind, spirit, all of it together. So that, in fact, I think folks listening to the open house might be shocked about this, but any student who's ever had me as an educator will tell you that I say B's get degrees. I would rather our students have a whole life and do enough to earn a B so that they can have a whole life. And I know that when they have a whole life, they're more likely taking in the content and the skills and the training that are really necessary to stay in this profession in the long term. So very nuanced question. Sorry it took me so long to answer it, but I hope it was valuable.
Absolutely. Thank you so much, Dr. Cox. So the next question I would like to just transition it to Dr. Davis. So Dr. Davis, what are the most common myths that you have heard about online education? One of our participants actually mentioned that one of the myths is that online courses in online courses, students do not have the opportunity to interact with professors. So people here want to know if you can share your experience as faculty teaching online, and how did you address student engagement and teaching effectiveness in your online classes?
Okay. Um, I will start that video, but I think that you'd have to start it. All right, while the video is starting, I will at least begin some conversation. I have changed locations to try to make it a little less interference with my little kids running around the house. Um, you're asking about some of the myths as it relates to online education and how do we engage students actively in an online setting. There are a lot of myths, and I'm sure I shared some of those myths before I began teaching online. I think the idea that online teaching or online learning is inferior to face-to-face learning is maybe the primary myth that exists out there. And so there's been significant research that has been conducted to determine whether or not that myth is actually true. And so the research shows that it is not true that online learning can be and often is as or more effective than face-to-face learning. And so one of the challenges that many students will face in online learning is this idea of feeling as though they're in a silo and they're being disengaged from other students around who are in the class but who are not face to face. And so that is a challenge I think almost all online programs are trying to better understand. One of the things I really valued and admired about UWS was they had a dedication um, to uh, trying to create an opportunity for students who are online to have a similar experience to those who are learning face to face. And I think that that is phenomenal, as it relates to student services, organizations, as Dr. Cox was talking about, different groups on Facebook and so forth, to diminish some of that feeling of isolation and being all alone out there as a learner, that you are also a part of a unique group of people who are trying to improve their life in this way. And so one of the things I have learned and have seen is that with students who are in various places, even without me saying so, they say, well, we're going to start a group ourselves. And in fact, my first supervision course this semester, this is my first semester at UWS, that is exactly what happened. The first supervision meeting was almost over, and the student said, well, give me your information so we can start a group right now. And they kind of pushed me out and started their own support group and a way in which they can share this experience together, because that's one of the unique things about college is that people at pretty much the same age groups typically go through this experience together. So I think folks who are online, whether they are the traditional graduate level student or a student who's older, as I was when I started grad school, they will find that the interest in being engaged by students, as well as the interest in professors engaging students in a variety of ways, is meaningful and authentic. And so if there are follow-up questions about that, I can respond to those. But I would say though that some of those myths about online education are actual myths, have been disproven, especially as it relates to the quality of education that one can get in an online setting, as well as the idea that you'll be all alone in your learning experience, because I think that you will find, especially in a modern day of Zoom and modern technology, that those connections oftentimes are more active than one might find in a face-to-face kind of a setting.
Thank you so much, Dr. Davis.
And can I add to that a little bit, Laura?
Absolutely.
I think it's funny that you say the students push you out and form their own groups, because that's exactly what it feels like. Like all of a sudden we're just not in there anymore. We require our instructors in each course to offer at least 3 one-hour Zoom sessions for students. So those are synchronous meetings where faculty are online and students can engage with them. And we try and schedule those in a variety of times. Those are required for our instructors, but they're not required for students. So students who are yearning for more engagement with faculty can get online. We also record those so they can see us. We're also very visually oriented as well as auditorily oriented, meaning we know that not everybody learns through reading or learns as well through reading. So we do a lot of work visually. A lot of our assignments are visual. when we get on and address, let's say, feedback from homework, we may create a video as instructors to show you that content. And there are just several things like that. I may give you feedback about your assignment using video feedback instead of typing editorial comments on a paper. We know that you're yearning for that connection. And again, we're in a relational field, so we're always seeking new ways to provide those visual connections with you.
Thank you so much, Dr. Cox. And then our next question is specifically about the interaction or the acceptance, more like it, of international students in our program. So this is coming from students specifically from Canada. So I'm gonna just read the question. I am an international student from Canada. Can you explain why UWS is not currently accepting international students? Counseling requirements in Canada are flexible in that allow us to meet certain hours of clinical practice in person or remotely. I really like your program because it offers great work-life flexibility.
Thank you for the compliment. That's true about our program. And we very much appreciate our Canadian friends. So I believe there will be a time in which we will be potentially accepting Canadian students. The difficulty with working with international students is for our university to understand the laws, rules, and ethics codes in other countries and the provinces in those countries. In the United States, for example, each of the 50 states have different laws about licensure as a clinical mental health counselor. And just the fact that there are different provinces in Canada would keep us from knowing what the laws and rules are in each of those different provinces. It's worth investing the time to figure that out. Right now, however, our orientation is toward CACREP accreditation, and that takes a lot of time. We're looking forward to getting feedback about accreditation sometime next year in 2022, and hoping all goes well with that. Our next orientation would be to turn toward what we need to learn in order to allow international students in the program. Good question, fair question. We want you, keep your eyes peeled, but it'll probably be at least another year before we even take that task on.
Thank you so much. And just for the information of applicants who are still interested in exploring other graduate programs, we offer a master's in sport and performance psychology. So if you are from Canada and you want to engage in meaningful work with athletes, coaches, and with population that really enjoys an active lifestyle as part of their wellness philosophy. So by all means, just schedule an advising appointment and I'll be happy to share more with you about the Masters in Sport and Performance Psychology.
Laura, you're muted. You've gotten in the habit of muting yourself after each response.
Thank you so much for letting me know. Okay, so this next question is just open. And the question is if you can tell us a little bit about the networking and connecting with classmates in the online format for students.
I think I covered that a little bit when we talked about connecting with instructors. I can tell you a story. It's my favorite story. A couple of years ago, the AASP conference was held in Portland, and I think we had about a total, Laura, do you remember, maybe 15 or was it more like 30 students that attended?
30 students.
Okay, so 30 students. So maybe 15 of them were students in our integrated degree program. And we had 4 female students who had never met other than in forum discussions online in their courses, and decided to room together and share a car together while they were here. And they were the hit of the conference. I mean, everywhere you went, you saw these ladies having a lovely time. And I really received the loveliest compliment from them. And that is that we made our courses safe. We made the discussion forums engaging. The questions were meaningful. They got to know each other, but not just each other personally, each other as professionals. And because of that, they built relationships, as Dr. Davis was referring to, outside of the classroom. Now we have plenty of opportunity inside our courses for them to develop relationship. But the real key is that they're learning so much from one another. They want to build relationship over time. And so Dr. Davis is right. They do that through Facebook groups, through telephone conversations. We even have an organic student group that was created by a number of students who wanted to get together and just advocate for the program to the university. And we encourage all that as well. So just unlimited opportunities, and we are still open to the creative thinking that our new students bring to us in terms of ways to facilitate that.
Thank you so much, Dr. Cox. And then our next question is specifically about practicum, internship, and clinical hours. So the question is, I understand the program in both the master's and the EDD requires the students to complete a practicum, internship, and clinical hours. Can you explain the process of identifying field placement?
Yes. So we have an entire course that is devoted, it's our pre-practicum course, to helping you prepare to find, contact, and engage with, that means apply and then interview for a practicum and internship site. Examples of assignments in that course are a reviewing and editing of your current resume so that it is clinical mental health counseling focused. We have an assignment in which you choose 10 of 25 questions that you would commonly see at a clinical mental health counseling physician interview. You answer those. We give you our feedback about your answers to help you hone those. Another assignment is a target site table. So we teach you how to utilize all the tools at your all the resources to locate sites in your area that you're interested in and how to determine if they're good fits for you by population, size, the age of the clients, who is supervising there. All of those assignments are designed to help you get to a point where you potentially have a number of options for sites that you would apply to. Then if you find a site that you think is a good opportunity for you, you submit a site review request form to me as the director via email. I then vet that site. So I review them via the internet. I contact the administrator or site supervisor and have a conversation. And I review the credentials of the site supervisor. So I want to know if they're licensed, what their license is in, how long they've been licensed, and whether there is any discipline against them. Once we've gone through that process and I've vetted everything, I then email the site and the student and informally approve the site. We then send an affiliation agreement to the site. That's a contract between the university and the site, sort of overviewing the responsibility they have for you as a student and our responsibility for you as a student. We also provide the student and the site with our practicum and internship manual. And this is an ongoing process, by the way. We're in communication with your site supervisors throughout your practicum and internship experience. So that is 5 terms. That's equal to 55 weeks of your master's portion of the program. If you enroll in the EDD, the integrated degree, at the end of that EDD, in sport and performance psychology, you will also have what is called a mentorship, which is another 4 terms of the hours that you must do with a specific population doing consulting work under the guidance of a CMPC that will allow you to earn hours toward that certification as well.
Thank you so much, Dr. Cox. So the next question is about the scope of practice of counselors. So I'm going to read the question is, can you explain how the scope of practice of counselors differs from other helping professionals such as psychologists, LCSW, school counselors, how the classes will help me to configure my own identity as counselor? And I think we would like to hear a little bit from Dr. Davis regarding that.
Sure. That's a great question, and that's a question that has been posed and asked for the last 20 years since I've been a counseling professor. Um, as Dr. Cox said earlier, we take significant pride in the fact that we are counselors and we have a unique and distinct identity. As working in hospitals and in agency settings, you'd have the opportunity to work with a variety of helping professionals, psychiatrists, psychologists, and so forth, and social workers. And based on my experience and the literature, each kind of have their own kind of niche. And so the psychiatrists that I worked with, they were more focused on pharmacology and medical medicine management, trying to make sure that the patient or client had the types of medicines in which he or she needed to function optimally. And thereby get the most out of the counseling relationship, because the client is feeling too overwhelmingly depressed, the client can't really function, then the client may not be able to do or benefit much from talk therapy. And so that was his our psychiatrist's niche in our program. And then you have the psychologists, and they might, again, they may be here and say, well, that's a little bit different than how we perceive it. But my experience of it and the literature says they do more of a psychometrics and do more testing and so forth. Even in the public schools, it's more about testing and trying to see whether or not there are some disabilities in which the individual is struggling with and therefore and needing services. In the counseling profession, I think one of the things in which we do more specifically, and I'll also talk briefly about social workers, is social workers, they're more focused on trying to garner the resources in the community to try to help individuals get those services they need in their respective communities. Mental health counselors are clinicians, first and foremost. And so they do some of those other things as well, but their primary focus is on therapy. And so, as I would tell people, Dr. Cohen, my psychiatrist, he made a lot more money than I made, but I did all the individual counseling, the group counseling, the family therapy, and I had a much more intimate relationship with those clients than he had or was interested in having. And so, the program. And Dr. Cox could speak more specific about our program here at UWS because she has much more history with it and she built it. But programs in counseling try to ensure folks, if they're in the school counseling track, they become most prepared to work in schools with school age children. In the mental health counseling track, clinical mental health counseling track, we are focused on trying to assist individuals in becoming very competent and capable to work with clients in a variety of mental health settings. And so um, they might work sometimes in schools, as I work in a school. They might work in private practice. They might work in a mental health behavioral hospital. But again, primarily focused on becoming a clinician, learning how to use the theories and the processes that are at our disposal to help the individual learn to be a helping professional that is able to hear another human being suffering and struggle and provide meaningful interventions that are beneficial to his or her well-being. So I really appreciate that question. I'm very passionate about that. I was saying to the folks just now in my supervision class, the SPP program, their responsibility is to prepare you to do that work. In the counseling program, as a clinical supervision supervisor, clinical and internship supervisor, my job is to prepare you to be a clinician. And so I will take that role very seriously, and I will do my best to prepare you to sit across from human beings and try to hear and help them with their psychological and emotional problems.
Thank you so much, Dr. Davis.
Sure.
Okay, so
You
the
know,
next,
you make me want to come back to school and take your class.
that's true.
Oh, that's kind.
So the next question is specifically about if you can tell us a little bit about the specific curricula for each type of graduate degree. So the master's and the integrated doctoral program. So I guess what this particular person from the audience wants to know is how similar are the classes that you're going to be taking in the master's and also in the integrated EDD program, and what are the classes that are different in it?
That's an easy thing to answer because in our program, they're not different at all. It's the track you choose. It's your career goals that will help you make a decision about whether you want to be in the standalone MS, our master's program in clinical mental health counseling, or whether you want a terminal degree, a doctorate in sport and performance psychology with clinical mental health counseling specialization. Because in either degree, you get a 90 credit MS in clinical mental health counseling with the exact same courses. And fundamental to our program are core courses that are common in the field. Things such as methods, how do you actually do this counseling work? Personality theories, how do you see people? From what framework do you see them? How do you believe they develop? How do you believe they become unwell? And how do you believe they become healthy? Ethics, research, tests and assessments. How do we assess mental health in our clients? We teach career counseling, group counseling, addiction counseling, just the entire variety of courses. And then in addition, because I really wanted to develop a well-rounded program, we also come from a systems thinking perspective. So we have a required course in marriage and family, marriage, couple, and family counseling. We wanted to make sure you had some basic knowledge about how the brain works and how medication works. So we teach a psychopharmacology course. We teach a psychopathology course. What are mental health diagnosis and disorders, and how do you determine whether somebody has one, and how do you differentiate between ones that are close and some that are vastly different? So we teach that. And then we have an entire variety of electives. So students get to choose 3 electives in their program. Those electives include things like trauma-informed treatment, eating disorder treatment, play therapy. So if you wanted to work with children or teens, that might be an option for you. My favorite is business basics for clinicians and consultants. Lots of people who want to be in a social science field or a helping profession don't have a business background like I do. So it's fun to get in there and teach them how to think about how they would set up a private practice, or either in counseling or consulting or both. So the program is essentially the same regardless of which track you take, and it's really your career goals that will help you make a decision about which degree you want.
Thank you so much, Dr. Cox. And then the closing questions, just to wrap up a little bit this roundtable session, has to do with specifically one of our participants. So they are looking for a career change. So they're basically looking at our counseling program as a second career path. And they're coming from a field that is not related to counseling at all. So then the question is, what are the different components? And I will also love for Dr. Davis to participate with an answer. What are the things, the things that you look at in an applicant that make this applicant a strong candidate to get into our program, and some of the recommendations when it comes to presenting themselves in their personal statement?
I think that's a great question, and I don't know if there's a specific answer that I could provide for that. I think it kind of depends. And I honestly, as Dr. Cox was saying, she came from a different background as it relates to vocation, as did I. I think what is critically important is having that authentic interest in helping human beings and being willing to be open to the process, so thereby you as a tool are fashioned and shaped to provide a meaningful service. And so again, that's for me at least, is a difficult question, because I think that folks from a variety of professions, and as Dr. Cox will attest, from a variety of professions, do come into the counseling profession because they have an interest in trying to see how they can make the world a better place and try to help children, help human beings who have been injured or who are suffering. And so the master's program has no undergraduate prerequisite, if you will, when it comes to a major. So I had folks in the program who were lawyers at one point in time and said, I'm tired of doing that. I want to see if I can be a counselor and work with children. And so we have folks with business backgrounds who say, okay, that's not the kind of world that I want to be a part of. I want to again be more of a helping professional. So to the person who asked the question, I would say, if you have a genuine interest in trying to better your fellow human being, and you're authentically interested in trying to engage in this profession, you're willing to take some risks yourself to as I've often said, some folks use hammers to do their work. We are the tool that does the work. And so as a professor, my job is to try to help hone the tool that does the counseling work. So if that individual has that kind of authenticity and that desire to serve, I think they'll be an incredible candidate for the program.
Thank you so much, Dr. Davis. And what are your thoughts, Dr. Cox, on that regard?
I'm going to be really bold because that's just who I am as a person, and say that if you don't see value in all human beings, you're not a good fit for us. It's just that simple. In order to be a professional in this field, you have to be passionate about the value that all people bring to the world, and all people bring uniquely to the world. And for me, that's number one. To be more concrete, I can say that we very much value evidence of that. So we have a question that talks about service and talks about the way you engage in your communities to enhance and encourage well-being in your communities and attend to diversity, equity, and inclusion in your community. So if you're coming out of a different profession and you haven't had the time to really engage in ways to help make your community better, I would encourage you to pause and do some of that work to really try it on and see if it's a good fit for you. And then if you want to come back and apply and write about that work, then that would be fabulous. In the counseling field, unlike many unlicensed professions, we as counselor educators do not just evaluate your academic work or your skill sets. We don't just hand grades out, though that is a component of what we do. What we also do is assess dispositions, and the easiest way to describe dispositions might be character traits. So we observe the way you interact with your peers. Is it friendly and open? Can you communicate well? Are you timely in the way you submit your assignments? Are your emails professionally designed? Can you be patient when you don't get an answer that you want or get one as quickly as you would like? All of those are fundamental requirements for us to do well in the counseling profession. So we're looking for evidence of those things, even in your application materials. One thing I see or I struggle with when I get recommendation letters, for example, is that the person writing the recommendation doesn't take much time to write about you and the nuances of your personality or your skill set, or why you're a valuable fit for the profession. So one concrete thing our applicants can do is really prepare their recommenders to understand what requirements we're looking for in the field, and to prepare your recommenders to write some good content that helps us to know you from their eye. So I hope that's some concrete things that can help.
Thank you so much, Dr. Cox. So thank you so much also, Dr. Davis, for joining us today with our roundtable session. We just reached the pretty much the end of the questions from participants today. But I'm going to just stay and explain a little bit about the admission process. So Dr. Davis and Dr. Cox, you're welcome to stay while I'm talking, but it will be just 5 minutes for people who are still looking into applying in to our program.
Well, either way, I'm going to mute and turn my video off. Dr. Davis, thank you for participating. Laura, thank you for hosting. And to all of you who are attending, thank you so much. We appreciate your interest.
Absolutely. I feel the same way.
Okay, so I'm going to then talk briefly about the admissions process, the application process. So now that some of you actually already had the opportunity to schedule an advising appointment with me, so thank you so much. But for those of you who still have questions about these sessions or any other questions regarding applications, please just feel free to schedule an advising appointment. You're welcome to call at 800-641-5641 to schedule that way, or you can just go to our website and we have a beautiful web page just dedicated with profiles and with bookings links where you can just click on it and select the time that is more appropriate, that is most appropriate for you, and you can schedule that way. So the other important piece regarding the application process is that please feel free to send unofficial transcripts so that we can expedite the process. The master's program has a specific GPA requirement, and also the integrated degree. The doctoral program with the CMHC specialization has a particular GPA requirement, but I think the best way for us to just go about that is just to send unofficial transcripts either to me or to the admissions office so that we can just go over those aspects on a phone call. And then we are currently accepting applications for the summer term. So our summer term begins the first week of July. So we do have two different deadlines. So we have a priority deadline and then we have a final deadline. So the priority deadline is May 7th for the summer, and then the final deadline is May 21st. So if you are totally interested in beginning your program in the summer, even if it's just one class in the summer and then in the fall transition into 2 or 3 classes, the summer is a fantastic time to start a program because perhaps you have more time to dedicate to your studies. And so by all means, start your application. We need 2 letters of recommendation. We need a personal statement. I'll share with you the prompt that we basically facilitate to applicants so that they can start working on that and thinking and getting all these ideas about how they can serve their community with a counseling degree. And then we are also asking for a resume that highlights your professional accomplishments or your educational accomplishments as well. And then the official transcripts must be from all post-secondary institutions attended. So that's pretty much the bulk of the application process and all the documents that we might need from you. If there is something else, like for example, if the GPA is not what we are looking for, then I will just speak with you individually. We try to really be very holistic at the way that we look at the applications. And we, as Dr. Cox and Dr. Davis mentioned, we really value each applicant for what they can bring to our program. So don't worry if your, for any reason, your GPA is not quite what we are listing in the website. We can definitely have a conversation about. And then for the personal statement, we're asking applicants to really write something along the lines between 500 to 1,000 words maximum, where you can really convey your career goals, your professional, your intellectual, your academic goals, and your interest in the field of counseling. And then again, after you submit your application, so the review process takes between 5 to 7 business days, depending if you have submitted official transcripts or we're still looking for those. But if you submit all your application documents, it takes even less time for me, for the advisor, to actually review the application. And then after that, we'll just move you to have a personal interview with the program director, in this case, Dr. Cox. And then from there, if you get accepted into our program, we are asking that you show your commitment to just beginning our learning community at UWS by submitting and paying the $300 tuition deposit that will be applied towards first quarter tuition. So just keep that in mind. These are some of the things that we are requiring for application, for admissions into our program. And then if you have any questions about the financial aid that you might apply to, either loans or FAFSA or something else, just please feel free to just contact the financial aid office directly. They are very welcoming people and they will just guide you through the entire process. Again, if you have any other follow-up questions for me or you want to schedule a one-on-one session, just please feel free to reach out via the webpage in the Connect with Admissions virtually. So thank you again for joining us today. It has been a pleasure to just go over your questions that you submitted in advance. And again, just please keep bringing those questions and we'll hopefully address them in the next open house.